woven through candid conversations, are often life's more truthful moments.
I consider myself a person in long-term recovery from drug addiction.
I've been in recovery for 15 years. I started out using heroin.
I've been in recovery for about 24, 25 years.
Anise Bailey Jackson, Adam Winepole, and John Torsch were all kind enough to sit down with us.
I've been exposed to a lot of death and trauma and hardships that I wasn't expecting.
And talk about their past addictions. That, for all three, started with prescribed opioids for pain in one form or another.
Drugs are real. It doesn't discriminate, and it can go through your family and really ruin it.
That, though, was the past.
Opportunity for expanding access.
Now, at what is the largest yearly gathering of policymakers and advocates trying to end the opioid epidemic, these recovering addicts are looking to the future, and it's scary.
What are these drugs doing to our country?
Well, they're killing us, first of all.
What are these drugs doing to our country?
It's killing our country.
What are these drugs doing to this country?
It's killing the people that we love in record numbers.
You have to explain to people how easy it is to get into trouble in using opioids.
Mark Carino is trying to do something about that. He is the president of the American Association for the Treatment of Opioid Dependence. They are using conferences like this one in Baltimore to grab the attention of policymakers like those with Health and Human Services to get more nationwide approval for mobile methadone clinics. Methadone is a medication used to help people reduce or quit their use of heroin or other drugs. Currently, there's only one such mobile clinic in existence in Rhode Island.
Demystify the treatment for this disorder.
The push for mobile methadone clinics is coming at a critical American juncture. In 2021, an estimated 107,000 people died of drug overdoses in this country. 75% of those deaths involved an opioid. But only 18% of people with an opioid use disorder receive medication as treatment.
Do you see that as the next kind of frontier of treatment?
Yes, without any question.
For those who have used methadone to recover from addiction, removing the stigma of a brick-and-mortar clinic would be huge.
To loosen up what we call the cuffs of the clinic.
All in hopes of getting Americans like these on the path to recovery.
Why is it important for you to talk about this?
Because it can help somebody else out.
In Baltimore, Maryland, I'm Chris Conti.